I'm just super excited. So for anyone who is joining, again, we can't see your names. I'll reiterate this until the Zoom room has filled up a bit more, but please feel free to either change your names or to put questions into the box or into the Q&A thing at any time. We do have a lot to talk about, and I'm so excited to have Dr. Dara Kass here with us for Zioness, the first event we're doing together, though we've been friends for years. And Zara is, I just called you Zara because that's my best friend's name. Dara is a quintessential Zioness, an activist for reproductive freedom, health equity, for gender equality. She has been doing amazing work on all of these issues basically her whole life. I'm going to give a quick bio. It is not comprehensive. Dara does so much. She is a graduate of SUNY Downstate College of Medicine and the Kings County Hospital Emergency Medicine Residency. She began her career in resident education at Staten Island University Hospital, followed by medical student education at New York University School of Medicine, and most recently was an associate professor of emergency medicine at Columbia University School of Medicine. A champion for gender equity and the advancement of women in medicine, Dr. Kass's academic work is focused on creating a more equitable workplace for women in medicine. Most recently, she has shifted focus to policy and public communication in regard to the COVID pandemic. I'm sure you've seen her in the media, on the news. She was on every network for the last few years. Dara has focused her communication on the impact of COVID on communities and families, empowering Americans to make informed decisions for themselves and their families. And she is now, as you know, because you registered for this event, she is the highest ranking political appointee in the New York region at the U.S. Department of Health and Human Services, where she's doing all kinds of work related to the issues that we have talked about. And given your commitment to public health, I know that you have a lot of thoughts to share, Dara. So first of all, just thank you so much again for joining us.
Thank you. I'm excited to have this conversation with you. It's an extension of all of our other conversations. It might as well be memorialized on the interwebs forever.
Exactly. All right. So just to start, tell us a little bit about you, how you got here, all of the things that you're working on now. It's a culmination of your life's work, and you're still very young, and you've accomplished so much. So how'd you get it?
Older every day. So the story you gave is pretty accurate, right? So I always wanted to be a doctor. I actually always wanted to be an emergency medicine doctor. I grew up, my mom was an ER nurse. And so that is, the legacy of a good Jewish mom is to raise a good Jewish doctor. And here I am. And basically I went into emergency medicine and realized soon after having kids that gender issues that did not plague me as a kid, right? So I didn't have a lot of theory about being limited just because I was a girl. Once I started having kids, there was actual practical limitations on my career. And so I started working on policy that would make it easier for people to live their full lives, whether it was having babies, being married, whatever it was that was end while you're a doctor. And I started working on that from a workplace perspective and also from a clinical service perspective. And I did a lot of work on policy and advocacy, which then translated to politics, which is, I think, unsurprising. Because once you realize that you are the change you need to see, right? You need to do the work in order to make sure that the world is better for the kids that we decided to have. I started getting involved in politics. And so that kind of growth from education and, then policy and advocacy and politics led me to be appointed by the administration to the Department of Health and Human Services, which is really the best job. I mean, I get to stay in New York, which is where I live and love and have my children are here and my family. And I get to really interact with the federal government and how it intersects with state and local government and stakeholders, especially at this time where healthcare is coming off of COVID and then dealing with so many other crises. We're at the center of so much of what needs to be solved in the world. And when you think about things like health equity and, undoing so many structural inequities that had existed in the past, it's an honor to be in the administration that is working hard to do that.
And you are dealing with so many different intersecting issues every day. And of course, they relate very deeply to Repro Shabbat, which I should have said at the beginning is what we're all doing here. Repro Shabbat is a National Council of Jewish Women initiative with a whole coalition of Jewish organizations that are dedicating this weekend. We're starting early here at Zioness with Dara. We also have a conversation tomorrow for Repro Shabbat with the president of the National Organization for Women. And the purpose is to make sure that we are talking in our homes, in our communities, with our families about the Jewish mandate that is reproductive access and reproductive freedom. And I know that that is something that you, Dara, are extremely passionate about. So the kind of next question that I really wanted to ask you is like, how far up the creek are we? I mean, I know obviously we can agree that we're pretty far up. Some people are trying to look at the bright side. You have really all the information. You're like a machine. I mean, someone could ask you a question about abortion access and you will like know, to the number. How bad is it, like compared to history?
So first I want to say, and this is going to get a lot into the weeds of like, what is, what could be, where are we, a lot of hypotheticals. And, that is beyond the scope of my regular job, right? So much like I'm home tonight here with you, this is something I'm doing in my personal capacity. And I only say that because I'm going to talk a lot about my experience as a mother, as somebody who's been pregnant, as somebody that thinks about innovation, and really a lot about what the government can do and can't do, or should and shouldn't do if we're looking for sustainable change. How far up the creek are we? We're pretty far up the creek.
And question. My very scientific question. How
right,
far?
but I think the other thing is that it's still, to me, a very solvable problem, the actual access to abortion issue. So the way I say it a lot of times is that, the whole system that got us here, it has to be fixed, right? The structural system that allowed for a single court decision to protect access, but not really for everybody, right? So before the Dobbs decision came, I had been giving lectures on self-managed care and abortion access in abortion deserts, right? If you were like 100 miles away from an abortion access place, and how abortion pills were needed to be more accessible, right? And restriction on access to abortion pills, which made it not accessible in states where it was still legal, right before the Dobbs decision came down. And there was a hesitancy to fix that problem across all kinds of administrations because, abortion is not something people want to talk about. Miscarriage isn't something we want to talk about. Vaginal bleeding isn't something we want to talk about. Like you can take it to any part of the conversation. And so there have always been things we could do to make the situation better, and we haven't done them. And so now we're in a situation where things have gotten markedly worse. Right? We're not only dealing with the loss of a constitutional protection across all 50 states, but 26 states, which we'll talk about, have moved towards restricting access to some sort of abortion access. And what's been amazing is watching state constitutions and other states-based issues, whether they are new ballot initiatives that have happened or previous interpretations of state constitutions that are protecting access, even in states where it may not seem like it would be historically protected. And then watching state legislatures try to remove those protections.
On myself, sorry. Continue.
No, you can clean it up. And try to remove those protections. And so what I would say is access to reproductive health care is at a crisis right now, but there is still a lot we can do. There's a lot we can do right now in our communities. There's a lot we can do nationally. There's a lot we can do together. There's a lot of philanthropy. There's a lot of innovation. There's a lot of fundraising. So there's a lot we can do, and that gives me hope. But it isn't a great landscape if you're trying to say we want to give the most vulnerable amongst us access to true reproductive health care. Like that definitely has been limited.
So in some ways, and I know you and I have talked about this extensively, in some ways we're like back in the 1950s, but in some ways we've made enough progress that we can figure out how to make progress given the terrifying situation that we find ourselves in. Is that fair?
Yeah, it is. I mean, I think that what I said before to friends and family was, it's not 1972, but we have new problems that come with being 2023, right? So like the digital security, the misinformation, the disinformation, that is not something that, that they dealt with at the same scale and certainly penetrating people the way things were, in a pre-Roe world. But one of the miracles of abortion medication has been the safety of self-managed care. Right. And so, when we talk about losing access to procedural abortions in certain states, you realize that, you aren't hearing the same stories of septic care, of back, alley terminations. And that is because of, a really safe and effective medication. And so, I think that it's a new conversation. And so much of what I've been doing personally in the past 6 months is really just educating my friends and family on this new normal. Right. Where are the new restrictions and risks like digital security, and where are the opportunities for growth like access to medication abortion and making sure that people have accurate information in their hands when they need it.
Okay, so this is going to seem a little bit elementary, but for anyone who might be listening now, might be listening later, who cares a lot about abortion, I find that this is a real thing that might be surprising for, someone like you who is so deep in the weeds on this. that there are a lot of people who, if you say, abortion pills, they're not exactly sure what you mean. Or if you say medication abortion, they don't know exactly what that means, as opposed to, a surgical or procedural abortion.
Yeah.
And for example, like when you say an abortion pill, someone might be thinking of the morning after pill, as opposed to what, I think you're referring to. So let's try to kind of define terms, like
Totally.
things we need to know, the very basics of like, you got pregnant by accident, someone got pregnant by accident, or someone is having a problem with their pregnancy and doesn't have access to healthcare and decides within whatever limit they're in, whatever state that they're in, the law requires them to make that decision and they want abortion pills.
Right.
Tell us exactly what you're referring to.
So emergency contraception is not an abortion pill, right? That is something actually, and the FDA recently came out with a clarification on that, because I think it's a really important first step to say, right? Is that emergency contraception is just that, emergency contraception.
But then after pill as emergency, like that's not talking
like
about
plan B, exactly. Right. And then, so then the question is that if you are pregnant and don't want to be, which is what I say, like, I think when we say things like pregnant and don't want to be, then that removes the accidental, non-accidental conversation. And, one of the things I think that we need to also reframe is this idea that how you got pregnant somehow determines whether or not you should stay pregnant, right? And to me, that is an opportunity for us to be allies with everybody else, like to really kind of have a cohesive conversation, because how you got pregnant really shouldn't determine if you have to stay pregnant, right? And when we think about a lot, at least that's my opinion, right? And I think when we think a lot of the exceptions that people who are trying to ban access to care like lean on, rape and incest exceptions, for example, or even life of the mother, which is not a defined thing, right? So as a physician, we talk about this, when you're in bed, septic, so infected, and there isn't a big light bulb that says, okay, it's time to do the life of the mother because you're not going to live if you don't get an abortion or you don't end this pregnancy. Like this is, it's a spectrum. And so it requires clinical judgment. And when you kind of invoke these these are the allowable exceptions because these are the good reasons you're allowed to have an abortion or you're allowed to end a pregnancy, but these are the bad ones, it confers this judgment that to me doesn't help people stay safe. It doesn't have any correlation to the outcome. So that's why I use the term you're pregnant and don't want to be.
You're totally right. You're totally, and any other term is going to end up stigmatizing. You're totally right.
Right. And again, so it's you're finding you're pregnant and you don't want to be, and you're early in pregnancy. And this goes back to the idea of being educated before you get pregnant. So one of the things we can do as women, as people, as teachers, as moms, as whatever you want to call it, is to teach people to know if and when they are pregnant, which again, sounds like a table stakes, but it's really important that our kids know how and when to get pregnant, or if they're going to be pregnant. Like this is basic education. And then if you are pregnant and don't want to be, and you're early in pregnancy and you don't have any reasons to not have this, so this is a medical decision that has to right now be prescribed by a physician, or a clinical provider, I should say. And there are telehealth ways to do it in states where it's allowed. You can go to a clinic, you can either take pills, which are two different medications. And one is called mifepristone, one is called misoprostol. And the reason that the two different pills will be important is that one of those pills is at risk of being off label, not being allowed to be used by the FDA, which is a conversation we can have. But there are two different sets of pills. You take them over a period of time, usually 24 to 48 hours, and then you basically get a period, right? And it's indistinguishable from a regular period or miscarriage, right? Once the pills are in your system and you bleed, you can't tell why the miscarriage is happening. The other is a procedural termination, and that is when you go to a clinic or a provider and you have the termination right there. And there are reasons why people choose both. And that is also something that we need to destigmatize, right? Is that how and when you decide, to terminate your pregnancy should be entirely up to you, your physician, your family, whoever counsels you, but should not be up to the access to that care or the way that the state around you has created laws. And so these are the things that we need to think about as we talk about how to make things better for people around the country.
So this conversation around the medication abortion and the pills and how you access them, and the fact that there is new guidance coming from the FDA, coming from the administration, that makes those medication abortion pills much more accessible than they had been in the past. And now, as you said, you can get them through the mail. You can, it could be like in an unmarked envelope. If you're in a state that might be a problem, as you said, that may end up being banned somehow. One of my, and now there's new guidance that says you can get it at a pharmacy if it's prescribed. One of my questions, and as you know, because we've talked about this, one of my questions is whether that actually helps, whether the pharmacy being able to hand it to you, because if you're in a state that is an abortion desert, or if you live in a series of states that are abortion deserts, your pharmacist is not going to give it to you, even if they have access to it, and even if you have a prescription. So, I mean, your pharmacist could literally be prosecuted for giving it to you in some states.
So I think.
Oh, you know this. I'm giving more context.
No, it's fine. There's a lot that you put out there, and I think we need to kind of unpack.
Tell me.
It's that it's conflating a lot of things, right?
Okay.
So let's start with the FDA has done a couple of things over the past, has clarified a few things over the past couple of months around the Plan B, emergency contraception, right? They have said that pharmacies that want to dispense medication abortion can apply to dispense it from a pharmacy, right? A retail pharmacy. That is not to say that in a state where it is not legal, they could dispense it. It doesn't change the legality of a state. What it does is it changes only specific pharmacies used to be able to do this, and now it's making it possible for brick and mortar pharmacies to apply to dispense abortion medication. On the telehealth, one of the things that came out of the last few years was the opportunity to use telehealth to get prescribed abortion medication, the pills we were talking about. That is something that is now allowable. And in states where abortion access is permitted, in states where it is not banned, you can do a telehealth appointment and get it sent to your house through the mail. There are issues about timing and all that other stuff. So none of these FDA clarifications change the legality in the state. Okay, that's like a really important thing to clarify about the where the FDA sits versus state law right now. And it's really important to say that, again, people get confused. There's so much confusion.
Yeah.
And I think that that's part of the conversation about, it's so hard to stay up to date on what is going on, that you can be me and be, basically versed in this every single day and still have to explain back and whatever. The last thing that I will say is this question about FDA authorization for mifepristone writ large. That is a legal case in Texas that is still to be determined and could have effects around the country. Unlike these other things that I was talking about, that if it's allowed in your state, then your state, you can have access to abortion medications in your state. This is the first time that a decision that happens in a state where abortion is restricted, so that's Texas, could actually impact other states. There's a lot to see with that, so I don't want to get ahead of my talking about it, but it's really important that people are aware that the conversation about access is about more than where you live, right? We're in New York. We have a lot of pride in being New Yorkers, and we feel excited, we vote actively, and we try to have representative, kind of leaders who think like we do. And so, one of my proudest things is that we now are putting abortion medications in our sexual health clinics in New York City, right? That is really, to me, a move in the right direction. We have an abortion hub, like a navigator phone line in New York City that anyone around the country can call and find out how to get an appointment. This is what we want to see around the country. I am proud to be a New Yorker, but if the FDA decision if the authorization of the first one is revoked, that has meaningful impact in New York as well.
So if the Texas case ends up being that mifepristone is revoked, how would that become an FDA issue? How would
unclear? So that's what I don't want. That's where we have to stop, right? And I say this as somebody who thinks about this a lot, and we don't know. We don't know more than we know. And so right now we need to just sit with the idea that understanding that there's a case is really important, and that we all need to be aware and concerned citizens about what's going to go on, and that this is all unprecedented. I mean, the other part for us is the idea of a vigilante law, that a regular person could sue somebody else for seeking healthcare, or that, that contraception could be at risk. These are all things that were unfathomable to me 5 years ago. And I'm like an emergency medicine doctor. I think of bad things all the time, right? So I don't want to go ahead of what could happen. I just want people to be aware that that is on the table and we have to pay attention.
Yeah, it's worth mentioning and actually worth saying a little quick disclaimer before I say this. INS is a 501c3. We do not, rate candidates for public office. We don't endorse or oppose candidates for public office. We are not party affiliated and do not have party preferences institutionally. Obviously, individuals have lots of feelings about this, but it is important to say that in a lot of states, judges are elected. In a lot of jurisdictions, judges are elected. So when you think about like being politically engaged and involved in researching who you want to vote for and really knowing the issues that are on the ballot, on all ballots, voting in every election, in local elections, in city and state elections, obviously in federal elections, every single time you check a box on a ballot, or it used to be pull the little thing, it really has impact way beyond what you might think. And so the judges that are hearing cases in Texas, I believe, were elected to make these choices, and this is certainly the case in other states. So these kinds of things are going to end up being before the Supreme Court. And we saw what the Supreme Court did in Dobbs. And I mean, literally women's bodies and people's lives are on the line here. So like your vote could not be more important.
Thank you for that monologue to get me to charge my computer.
I'm so happy that you had that little opportunity. Sometimes I like to just talk about the importance of voting in elections. Okay. So you mentioned something before that I want to come back to. You mentioned that, the phraseology that we use, the terminology that we use is so important. And I used a bad phrase, and I want to be really careful to say people who are pregnant and don't want to be, because that could be anyone. That could be like, there are so many different categories of people who could be pregnant and don't want to be. And we do this thing, and a lot of us fall into this trap. I mean, I'm sure you agree that even just the terminology we use of like pro-choice versus pro-life is pretty stupid, that we fell into a trap that like, if you oppose women's reproductive freedom, you therefore are pro-life, and the rest of us are not pro-life or anti-life. Do you think it's the case that those of us who accidentally use terms that we think are kind of plain English are actually perpetuating the challenges that we're facing? So for example, when people talk about, like, people use this term partial birth abortion, which if you actually look it up, it doesn't really mean anything, but we like use these terms to be like, well, there is such thing, as you said, as like a good abortion versus a bad abortion. How do we kind of overcome the fact that like these narratives are in the air and we breathe them in and then we regurgitate them without actually thinking about it? And how do we undo that, given that it's subconscious so frequently?
Well, I think that's so much of the work that we're facing, right? Is that there's a constant assault to use language that is simple and simplifies issues that aren't even necessarily real, like terms that are zingers, like partial birth abortion, but they actually don't mean anything medically. Or like the idea that ectopic pregnancies are somehow treatable, or that you can wait on them. Like there are so many things about the way that people that don't want to promote safe and accessible healthcare will try to get into people's minds. And sometimes you don't even realize that you're being said something. Like a really good example is like crisis pregnancy centers, right? So for like, I think most people have heard about them, but not really, right? So there are these places, especially in areas where abortion is restricted, but they're really everywhere, that look like abortion clinics. Like they even say like, come for your ultrasound or need information on an abortion. Like they are so scary good at disseminating this information to look like accurate information. And, you Google, I need an abortion, or I'm pregnant and don't want to be, or what to do with an unwanted pregnancy, or whatever the term you're going to use is. And then in the Google search will come up these clinics, women's health of blank state, or, kind of compassionate healthcare. And the next risk is if you go to one of those centers and it's not a health clinic, which means it's not protected by the same privacy laws as health clinics are, it's not regulated the same way, you could be at risk for your information getting out there. And that is a new issue that has to be addressed while we look at how to keep people safe, right? And I think that that's complicated. And so I think that constantly making sure that you're having accurate advisors and that you're listening to accurate information is really important. And asking questions, like if something doesn't sound like a normal term, like why is it that we are 40 years old and have never heard the term partial birth abortion medically? Here's a child of mine.
That's a hero.
What?
Yes.
We're live on a thing.
We love this.
Yeah.
Yeah.
So I
Okay.
think that it's really, close my door though, if you're going to be helping, it'd be helpful. I think that one second. I think that it's really important that we remember that as we use terms, we should know what they mean, is what I'm trying to say. And that we don't perpetuate these stigmas. And honestly, there's inaccurate information more than we need to.
So basically, we all have to think really carefully about every word we say because we've been fed all of the stuff that we haven't really like thought that much about.
Yeah, but we also need to give grace to each other, right? So like, it's okay to make like, everything can't be perfect all the time. And like, we can't, we're trying here, right? And so it's okay to just say, unexpected pregnancy or unplanned pregnancy, and then go back and say, you know what, maybe that's not the best term, I'll use a better term next time. And then me say, you know what, you tried.
Right. No, of course, like in interpersonal interactions, we should give each other grace. But I mean, on a broad scale, and this is obviously abortion is not the only, or reproductive freedom is not the only issue that this is the case for. I think like progressives in general are really losing the battle on a lot of like terminology fights and like oversimplification issues. But it really, I mean, I think and talk about these issues all the time. And I, didn't think about it enough until you just said it, to be like, wow, I've been using a term that is totally, it's not even, I mean, stigmatizing is problematic enough, but it's the fact that the narratives really matter and shift the way people think. So if someone is thinking with the wrong terminology, they could end up believing something that they don't even intend to believe because like words.
Yeah. And again, like, I think that we all have our decisions, what we do for ourselves, right? Like, but that isn't always how we should frame this or the language.
Right, of course. All right. So it was just totally shifting topics here. And there's just so many things that come up as we're talking, but I want to, given that we have, so many things that we wanted to cover, I want to bring us back to one of the things I really wanted to talk about, which is an article that came out a couple of days ago in the New York Times that was talking about Black maternal health and Black maternal mortality. And some of the conversations that I've had since that article came out and conversations that I have whenever there is like an issue or a story of Black maternal mortality that becomes like a national story, somehow someone famous, has a problem or something. But these conversations do not happen nearly enough. And I think that like it is such a small percentage of people, probably even within the Black community, but certainly outside of it, who are aware that health outcomes for Black women who are pregnant or in delivery are so much worse than for white women. And so there was this article that said that Black women are 3 times more likely to die in childbirth than white women, which is just so astronomically insane and so hard to imagine and believe unless you follow, the ways that systemic racism intersects with access to care and health outcomes. So talk to us about this. And I know you have so many unique perspectives having had these conversations yourself.
So I was on a panel this morning at a group called She Matters, which is working towards creating culturally competent healthcare for Black women, mostly around maternity care. And we were on a panel talking about this exact issue. And I was the only white woman in the room, right? And I was saying before that when I walked in the room, actually, people didn't realize I was a white woman. They thought I was brown or some, so either. Many people had many impressions of what I was. But ultimately, when I said as a white woman, or I said as a Jewish woman something during the conversation, everyone's like, oh. And it was amazing because the conversation was actually very real. And I don't know that it was realer than any conversation I'd ever heard. And the conversation was centered around this article and how it's not just that the maternal mortality, depending on where you live, could be between 3 and 12 times higher for Black women versus white women. But that this article, which was done at a study in California where they tracked women who were pregnant and gave birth, that it didn't matter if you were rich or educated and Black versus if you were poor and uneducated and white. Rich, educated Black women did worse and had worse outcomes, not just for themselves, but also for the babies, than uneducated, poor white women. And what that really showed was that you cannot, and the way that I said it is, you cannot bootstrap your way out of this problem, right? There is no individual answer to systemic racism in healthcare, right? When a Black woman gets pregnant and goes to the doctor, and there is data that shows that if a Black woman is taken care of by a Black woman, they have better survival rates. That is true for actually women physicians and women patients writ large, but has been proven actually with Black women and Black women physicians. Still, you still receive the stigma and the bias of the healthcare system, whether it's the receptionist, whether it's the physician, right? We know that physicians of color still have bias. We know that women physicians still have sexism and misogyny in the way that they interact with other women. So it is not your own identity doesn't prevent you from having bias against somebody because of their identity. And so one of the things we were talking about is that as white women, as women that try to be allies to, anybody who doesn't share our identity, that it's critically important that we talk about this and that we open up the conversation around things like mental health, right? So the stigma around mental health for Black women, specifically Black women that have given birth. I heard stories today that I don't even know if I can repeat, but the way that mental health support is treated in some people's families is with shame and guilt and denial. Yet for me and for you, like, it's like, we welcome the idea, right? We welcome the idea of therapy and medication and anything that can help us feel better and actually, make us whole. And I think that was really eye-opening to me. And I also remember that maternal mortality isn't just till you give birth, it's actually for the full year afterwards. And a third of women that actually have adverse outcomes from their pregnancy, that happens after they give birth, whether it's postpartum preeclampsia or depression or heart problems, something called cardiomyopathy. And so I think that one of the things we just need to be aware of is that this is a conversation we need to have in our community with our friends and family, and realize that, like everything else, until these things get addressed, and that includes abortion access, right? We know that abortion bans are racist, and we say that because they have effects on people disproportionately based on their race, right? Am I frozen or are you frozen?
No, neither of us is frozen.
Oh, okay. And I think that is important to say out loud, right? Because when we say it, it makes it easier for everyone to say it. Because, we're in the community where so many of my friends are like, I don't know that I worry about sending my kid to a state where that doesn't have abortion access because I can always fly them home, right? Well, not only is that immense privilege, but that's not always true, right? Because if your kid isn't the one that's getting pregnant, but instead is Googling, abortion medications on a computer in a state that has a vigilante law, what's stopping the third suite mate from, turning that person in?
Right. Now
you're on us to be the agents of change all over the country.
Right. A thing I was just thinking about, it's a side note, but it ties in, is that today Senator John Fetterman checked himself into a hospital for a serious mental health issue. And I noticed, and obviously I follow a certain type of person on social media, but I noticed so many people really celebrating his courage in doing that, because there is such a stigma. There is such a, an idea that if you are struggling with mental health, then, something else is wrong with you, or, you're never going to recover, that you should be judged for that forever. And it just is such, obviously that's not about any community of people in particular, or any threatened minority, but like, it is taking so long for the stigma of mental health issues to, kind of be eliminated, that even this like white man from my home state of Pennsylvania, that it's such a big deal that he would seek mental health, that so many people are talking about it. Again, I have no problem with people talking about it and celebrating him, but like, they're celebrating him because other people are attacking him for it. So
yeah. And
go ahead.
But I think that goes back actually to one of the things that I think that, again, in my day job, this administration has done, which is work on this 988 crisis helpline, which is a 3-digit number that was transitioned for anyone in crisis. But it's also part of a larger conversation around destigmatizing mental health access across the board, and realizing that we are in a moment post-pandemic. And I say that as a generational term, not necessarily for the way that the virus is circulating, what we're doing, but in this time of being back in school and back in work, and our kids having this time in school, and things getting upended, and 1 million people dying, and all these things that have happened to us that are almost like dystopian and feel like a movie sometimes. Like, our entire generation is going to have to deal with the kind of the trauma of living through this moment, and it's going to be important for us to reconcile that. I think, again, to be a little bit of a tangent, one of the more moving things I've done at work is actually do these COVID listening sessions in communities that were devastated by early COVID, and listen to the people who survived, even if they were hospitalized or lost family members, and have them talk about, what happened and how they've coped and what got them through it and what they would want going forward. And I think that, again, if you go back to the access to reproductive health care, right, how many insults to your autonomy, freedom, and survival can you take before you break? Right? Like,
Plus,
what do we need to do to protect people's freedom to live? Right? They just survived COVID and they survived a pandemic. And now, they find out they're pregnant and don't want to be, and all of a sudden they're back without the choices and the freedom to live their future life. It's not, they're not separated. You know what I mean?
Right, at all. So, okay, I want to jump back to the Black maternal mortality conversation, just to kind of touch on a thing that I think confuses a lot of people, people who are really surprised to hear about these numbers and the impact. It's one thing to think there might be different outcomes when it comes to like skin cancer or something, right? Like something external that's maybe harder to identify if you have darker skin, or, that maybe manifests differently depending on the amount of melanin, or, something like that. But internally, it's just so hard to understand how there's different treatment or different, a different way of assessing or analyzing a medical problem. So like, how does it become, I mean, it obviously is like compounded effect, but like, how does it become the case that a woman with Black skin, a pregnant person with Black skin would end up 3 times more likely, a wealthy person would end up 3 times, and I guess a person who doesn't come from money would be up to 12 times, more likely to have adverse health, consequences. What happens along the way?
So again, I mean, these are generational issues. This is deeply embedded in our healthcare system. These are related to things like perception of pain, access to care, confounding, structural issues. And I think that, and training, right? So our healthcare system was built on white male patients. Right. And so that is how we learn to like even the analogy about skin cancer, right? Like that analogy alone is rooted in the idea that our training is on white skin. Right. And so I think that all of it needs to be looked at as we look at the outcomes and the disparate outcomes and how they affect people in our communities. And we need to make sure that we have research that is representative, so that we have outcomes that are applicable to patient populations. And that is another thing that, I feel like proud of the administration that they're doing, that they're making sure that patient populations that go into cancer research, which is exactly what you're talking about, are representative communities. Because if you don't have representative patients in the study, you don't have representative outcomes in the data, you don't know how the medications will affect the same population of people. And so I guess my point to you is it's that big of a problem, and it's been forever, right? Since the House of Medicine started, there have been biases in our system that are now perpetuated. And one of the ways we see it manifest in so obvious of a fashion is in the maternity survival of people that are Black versus white. I mean, it's that basic. And that, if that doesn't shock all of us, especially people that claim to be pro-life, quote unquote, right? Like things like expanding Medicaid, things like making sure that people have access to blood pressure cuffs postpartum if they are having postpartum preeclampsia, things like making sure that we believe people when they say they have a headache. I told you a story of a friend of mine who is a Black woman physician who gave birth, and she refused to get an epidural, which I still don't understand. I was very excited to get an epidural when I had my kids. But she had headaches for days afterwards, and she was on the ground, like literally in the fetal position on the ground. And people in her own family and physicians said, suck it up. You just gave birth. You're tired. Your headaches don't matter. Like, just deal with them. Take some Tylenol. She had something called bilateral subdural hematoma. She had bleeding in the brain on both sides. Like, the bleeding was on both sides so much that she didn't shift because she was just smushed. She did well, but only because somebody finally believed her.
Right.
It's crazy.
Unbelievable. Like, just unbelievable that this is a Black physician, female physician, and still that, this could be an outcome that it's unbelievable. So, okay, going back to the fact that abortion bans are racist, I wanted to talk a little bit more about that, because as I'm sure you know very well, there are a lot of people who say, no, they're not, they're across the board. It's about protecting life. So many arguments that just seem to get recycled. one of the things in the law that we talk about a lot in terms of like how you could challenge a law that is problematic is that you could challenge something for being intentionally discriminatory, or you could challenge something for having a disparate impact. And it seems really obvious that abortion bans have a disparate impact on communities of color, on, you know, communities, obviously in certain states, that goes without saying. Obviously, you know, women from, you know, marginalized communities, from Native communities, from underprivileged and underserved communities, from poor communities. How do we get people to care about that? How do we get people to not only care about wealthy white women? And I know this is such a basic question that it's impossible to answer, but it is like we just lack a care for humanity sometimes in this country. People don't care. Or am I just being dramatic?
Well, I think that we remind them that it will affect us all too. Like, I think that, and I because sometimes people are not going to care, right? And what?
It's cynical. I mean, I talk about this a lot, you know, with saying why people should fight anti-Semitism. And I'm like, you might not think it affects you, but it emboldens white supremacy. It does affect you, even if you don't care about Jews, which feels horrible as a Jewish person. But if the argument works, you make it.
Well, but one of the things I think that we've talked about is like, you know, like abortion bans, particularly like access to reproductive health access to reproductive health care, like are a bellwether for many other restrictions on freedom, right? Like this is not new and it's been written about a lot, right? There are many books and many dystopian dramas that start with, you know, like loss of certain freedoms, including reproductive autonomy, and then they obviously voting rights, and then the democracy, and here we are, right? And so it's really important that we internalize that lack of access to freedom is a march towards lack of freedom for everybody. Okay. And so this is something that I think we all need to care about in that way. And yes, it's true that some of these restrictions to things like voting or abortion access or a bunch of other things will affect certain people more than they may affect us. Like people who feel like, I live in New York and I am, you know, whatever, my voting rights are not going to be restricted and I'm already, my tubes are tied, I don't need an abortion, like, you know, whatever it is. And so I can accept myself out of this structural issue that is in front of me. But that structural issue is the door open to the other parts. And like what I mean, as Jewish women, you know, we are not on the winning side of restrictions on freedom. Like we know that, right? And so it is up to us to continue to advocate for the freedoms of everyone, because those are integral to our own freedom, even if we don't feel that every single day.
And the Dobbs concurrence makes very clear that they're coming for other rights. Like it's not a secret, they're not hiding it. So
no, they're very, very good at saying the quiet parts out loud. And I think for us as people who are in our communities trying to make change, you know, I mean, like people don't really think about, you know, contraception. They're not going to get taken. Of course, somebody is coming for contraception. Of course, somebody is coming for every single freedom that we have that is related to the ability to get pregnant and a bunch of other things, because why would they stop? Where's the why would they stop?
Right. No, they're not going to stop. So, okay, that's a perfect segue to my next question, which is where you see, and you could pick what you like of these different options. There are so many different battles going on in the abortion access space and the reproductive freedom space. So like there's legislative, you know, issue. There are legislative fights happening. There are constitutional fights trying to update and edit state constitutions and, you know, get new constitutional measures in place. There are electoral arguments obviously to be made, and there are litigation strategies that are being pursued in a variety of states on a variety of different subjects, not just, as you talked about already, the medicine, but, you know, religious liberty issues, freedom of you know, religious practice. So where do you see the most successful initiatives, or do you just think it's a combination of all of the above?
Yeah, I think this is the kind of thing where we need to walk and chew gum at the same time. Really, I mean that honestly, right? So like eventually a constitutional protection for all things related to your gender is part of it, right? Or related to the ability to get pregnant, like that is the penultimate, right? Because that is the final thing that cannot be undone by a single arm of, a lever of power. But that is a very long way away and not a thing we can only wait for, right? Much like we also can't only wait for a single piece of legislation, right? We can't only wait for for Congress to protect abortion access or protect, even contraception, because this Congress and this time and, this is a time of bipartisanship, better actually than in many previous years, but still, this is not the kind of issue that clearly looks like it's going to galvanize a bipartisan movement towards legislation. So that means that we need to do other things also, right? So you want to create a world where legislation can get passed, and that includes making sure that you get elected officials in place that will do that, right? That's fine. That is yes, of course. Then you go to states and you realize that as state laws, as it goes back to states, state protections become critically important for protecting access to care. So like I said, we're New Yorkers. There are state protections in New York, and there continue to be more protections around access to care that mean that if you're in New York and a person who lives in New York and seeking care in New York, you have more access to care than in a state like Ohio or Alabama or Mississippi. And so creating more states that have those protections is a very important thing. However, that could be done. And so in many ways that can be legislatively. So flipping the entire legislature in Michigan, was, a very good thing. And I think that's important to remember that now you'll see legislation get passed, but also things like ballot measures, which allow the people to make a statement around protecting access to care. And then you have, like you said, like the lawsuits, right? Those are really, really important also, because they keep the immediate harm often in check, right? And they are all dizzying, and they are all overwhelming. And so if you can't pay attention to so much of it, you can pay attention to one of those things. But I think that, for me right now, making sure that as many states have access to protection and creating as many states across the country that are safe for people that need services. And if we can expand those to 2, 4, or 5 more, to me, that's where I'm paying attention for the next couple of years, because regardless of who's in power of those states, remember this, you saw Kansas protect abortion access, right? Yeah. And so you also saw Michigan, right, protect abortion access. And there are other states that may not traditionally feel like they would be ready to protect abortion access. But again, we saw the people of South Dakota using a ballot measure expand Medicaid, right? These are popular positions. These are progressive, popular decisions that the people of the state, when they know what's at stake, vote for.
Even when, as in Kansas, the ballot measure was so confusing, intentionally confusing, that people couldn't what the words were, but they did the research and they figured it out, and they were like, we are not going to let this one go. So
right. And that does inspire me.
Yeah. So inspiring. So, okay. So the flip side of trying to expand access in certain states, or even to take states where there already is, a lot of access, and make the states themselves literally more accessible for people from other states. What do you think about the kind of boycotting stuff, the conversations about refusing to travel to states that don't have abortion access, or are restricting or banning abortion, refusal to do business there, refusal to do Hollywood movies in certain states, not wanting to send your kids to college in certain states? I just heard a story about rabbis in rabbinical schools who are not accepting job offers in states that are restricting abortion access. And so that's going to have, downstream effects, obviously, for the Jewish community. So all of this stuff is going to have downstream effects for the entire state. And we talked about this before. You mentioned brain drain, right. So you think about all of that.
No, I mean, that's because this is one of those issues that it's not just about the position of the state on a theoretical idea, right? And I don't know the last time that there was a theoretical restriction or ban or whatever that wasn't as applicable, but the people that are choosing to do business in Georgia, or a state that's because that was the one that we're talking about with the movies. It's not only about the restriction politically. Like, it's not always about taking a stand on the culture. It's also about the fact that by living there, you yourself could be at risk. And so when we think about residency training for physicians, or college, or, you know, being a professor at a college, not just a student, you know, if you're a young male professor who plans on bringing his wife to the state that you're going to live in, and she's going to try to get pregnant, or you're going to get pregnant together, and now her access to care is different, you know, what if she goes unexpectedly to the hospital and has, you know, it isn't always predictable when you're going to need to seek access to care. And so I think a lot of people are going to be thinking about it, and actually even more than college students, right? More grownups, if you will, people further on are going to be thinking about it. But in medicine particularly, it's not only about the environment you want to live in politically, or even how you're going to be at risk personally, but also how you train. And what is the legal and the medical risk to being a trainee in a place where the access, the delivery of healthcare can be legally fraught. And so I don't know what's going to happen, but I think that, you know, this idea of the chaos of the 50-state strategy around this central issue on healthcare is just the ripple effects of what seems to be, like, politically in certain sections, like a super easy thing to just ban. I don't think we're even remotely understanding the ripple effects on our culture, our society, our education system, all of it in those communities, and not everyone can move.
Do you think that is somehow going to turn into an opportunity, that when states see the impact that this has on their economies, that they might reconsider? Or do you think that, like, once God is invoked, there's really no rationalizing?
And personally, I think that I think people are going to be the agents of change if they're given the chance here, right? So I think it's what we see with these ballot initiatives, is that if given the chance to vote on restricting access, and especially as we see kind of the layered harm and effects, I just don't think people want to restrict I mean, we know it's overwhelmingly popular in the general populace, but I think even in states at the state level, like, the more stories that are told of people who were, like I said, you know, expectedly pregnant, who found themselves in the hospital with a, you know, premature rupture of membranes, who had to get septic because, you know, that they weren't allowed to have their abortion. And then what we're going to see also, which is the blaming of doctors and patients by people who are passing these bans, which we're hearing about this, right? Well, you could have gotten an abortion if you had known the rules, or your doctor should have given you the abortion because you were one of the ones that was allowed, right? That's where this whole term of, like, allowable and, like, good and bad gets so complicated, because, like, if this isn't a judgment, right? And, like, after the fact, to say to somebody, no, that you, like, yeah,
the morning quarterbacking your, you know,
10-year-old, right, that had to fly, one of the first stories of this whole thing, from Ohio to Indiana, when it was still legal in Indiana. And then the idea, no, she would have been allowed in Ohio, and nobody not just knew that, but, like, there's real data out there right now that people are not getting care under the rape and incest exceptions, even in states where they're supposed to, because those are super complicated. So, like, again, like, I've gone off the rails here to say that anytime you restrict access to healthcare, people suffer. They die. They get sick, right? Aside from the fact, like I said to you before, is that healthy pregnancies, wanted pregnancies, planned pregnancies, and even unplanned pregnancies that are desired pregnancies, like, this is what our society should be moving towards: supported, accessible healthcare. Like, it should not be earth-shattering to say, even if you get pregnant unexpectedly, but you want to stay pregnant and you want to have a baby, let's make it, like, let's support you through that process, right? But if you are unexpectedly pregnant and don't want to be pregnant, forcing you to stay pregnant is an unhealthy choice for you, for the baby, for society, right? That doesn't seem like this should not be a big lift.
Right. So that goes into a question in the Q&A, and then I do have, as you know, a couple of questions I want to close on. A few really important topics we haven't covered yet. So somebody in the chat wrote, how is that, and it just goes to your point about, like, if there's, someone who could be covered by the rape and incest exception and doesn't know how to do it, or is afraid that they're going to be prosecuted, or is going to have to prove something that like they don't know how to prove or aren't comfortable, don't want to put themselves through. I think this question refers to that. How is someone in a state with a draconian abortion ban going to call or text by a phone to a center to get the abortion medication? If their phone records or computer history is being tracked, won't they be found out?
Again, this is complicated. What I will say is that in a state like this, and this is where we can't really give not just specific advice, but more importantly, in a state where abortion access is restricted, right? And the way that we say that, and to say that there is nothing that I'm going to say here around accessing medication that is banned in a state, because that is a very complicated conversation that people are having in spaces like Reddit, right? But I will say that the risk of searching for access to services in a state where abortion is banned is real. And it hasn't been prosecuted yet, but I would say that it's not an absurd thing to be nervous about. What?
It's a matter of time.
And that's why there are things like, making sure that the period tracker you have, if you use one, doesn't have a back end, right?
That was my next question I wanted to ask you. So I don't know if you're going to plug this as much as I want you to, or if you can, but you've been really involved in trying to keep up with the technology that makes people vulnerable. So many people have period tracking apps or whatever, any kind of app that like tracks whatever medical history or hormonal balances or whatever, that can make people vulnerable, that could be hacked, that could, be transmitting information that you don't want transmitted, that could be tracking you on your phone.
Right. So I'll say this, and then I want to answer the Jewish question, because I think that's obviously one of the ones that we want to make sure we answer here. But so there is an app called Yuki, which I have found in the process of figuring all this out, that was built for women in countries that restricted abortion access. It was done by a reproductive health organization called IBIS Reproductive Health. And it has no back end. What it means like that is if you download it on your phone, there's no conversation, there's no cloud, there's no server, there's nothing to subpoena, there's nothing to hack, right? It's only on your phone, and it doesn't save any data, and it has auto delete functions and all these security things that we would never have thought about, right? But the people that think about protecting vulnerable people in countries where access is restricted, they think about this. And the reason I talk about it, and I have it on my daughter's phone, and I want to make people to understand it, is it's still going to be important that people have access to information in their phone rather than go to Google, right? And so if you can have an app on your phone that has no backend, that has been vetted and securely discussed through Consumer Reports and Wired and all those places that tell you what safe apps look like, but it does not have storage. Like that's like part of it that's really important, because if a server gets subpoenaed, and these are all hypotheticals, but we have no idea what's going to happen next, right? Then apps like that have information on what does it mean to have a miscarriage? What do I do if I'm, there's information on medication abortion in the app. And so you don't have to Google it, right? Now, again, like there are hotlines you can call for information if you're in a state where abortion access is restricted, to find out what your options are. Very often it's leaving the state to go and get care somewhere else. But that's kind of where we are right now, is that if you're in a state where abortion access is restricted, it is less safe and more complicated for you, regardless of any other part of your identity or who you are.
Okay, so the Jewish question, and then one more after that. I'm sorry we're running a couple minutes late, but these are both really important questions. And thank you so much, Dara. You are a true wealth of knowledge. Obviously, as you know, I wanted to ask you, as a very proud Jewish woman doing the most incredible work, I wanted to ask if you, well, first of all, for you to reflect on reproductive freedom as a Jewish mandate under Jewish law, which is the whole purpose of Repro Shabbat, is that this week's Parsha, the Torah portion for Shabbat this weekend, is about the fact that the mother's life is paramount, and that lasts until delivery. So, any idea that we would restrict abortion access is really contrary to Jewish law and Jewish religious freedom. how do you feel as a Jewish woman when it comes to these issues and being such an advocate for these issues? And then also, kind of the corollary to that question is, have you ever experienced anti-Semitism or anti-Zionism in your repro work? And, how do you handle that?
So the first question is, like, abortion access is a Jewish value 100%, right? Healthcare access is a Jewish value 100%. The life of the mother prevails always had, the health of the mother prevails, actually, in addition to life. So this is a very important issue. And I will say that as somebody that grew up conservative and learned a lot about kind of the maternal lineage about Jewish values, that has always been foundational to my understanding of Judaism, right? But it's more than just how we feel for ourselves. It's that we feel that, that is how it should be in a good way. We should support that for anybody that we like, that is more than just for Jews. Like we aren't just like, oh, no, we're only going to protect abortion access for Jews. We're only going to protect the life of Jewish women. We believe that that is something that we should protect across the board. So activism in this space to me is a Jewish value, right? Making sure that access to care for anyone, is available. Like that is a Jewish value. So that's that. I would say that anytime you're vocal about being Jewish or active at any point, you run into things like anti-Zionism and anti-Semitism. And for me, actually, the place that I would say it's been the worst is Twitter, right? So I actually stopped tweeting because of anti-Semitism, not because of anything else. Like I had been, and for anyone who knows me, like I had been on Twitter very much for years and had lots of names and terrible things being called of me. But after Elon Musk took over Twitter, that the anti-Semitism on Twitter just through the roof. And I was called Juden for the first time in my life on Twitter, right? Like, I mean, whatever. And so you realize that that's an anonymous thing, but then there become other kind of not so anonymous things. And more importantly, real risks to your, not just personal safety, but to like, do I need to be part of this? But I think that goes back to the idea that we still have to be proud of who we are, and we have to be vocal about what we believe. And we have to be honest about what that means at intersections. And again, we also need to be advocates and allies. And we don't do well when we protect only ourselves.
Right.
And I think that is true for every group, but it's really true for Jews. Like we're really our best selves when we align with other people and really specifically other marginalized groups, right? Like the coalitions that have been built across American history of Jews have been the most powerful coalitions, and most movements have had Jews as partners, and right?
Yeah, founders and leaders of every progressive movement. Absolutely.
And so we should be those partners in this space, because to me, this is, again, one of the bellwether issues of freedom is access to reproductive health care, voting rights, assaults on the democracy. Like this is where we need to be to protect all freedoms, including and especially ours.
Yes. And so I think it's safe to say you agree that refusing to choose between your Jewish and Zionist identity and your commitment to reproductive health, reproductive freedom, allyship to other marginalized communities is where you would fall, that you want to hold all of it together and make sure that you don't ever have to make a choice between those two things because we see them as interconnected. Am I right?
Yes. I mean, you're totally right. But I think that that's actually this false choice that's being put on people that are trying to oppress others, is to use sometimes our identity and say, if you're with us, we're going to keep you safe, but all of a sudden everyone else is going to be at risk. And somehow there are people that somehow are not seeing through that as being a facade. And it really, that's what scares me.
I mean, to your point before about the fact that like, this is the right to abortion access is foundational, and that if this right is being threatened, so many other rights are going to be threatened or already are being threatened. And so, it's kind of like, the Jews being the canary in the coal mine, or Repro being the canary in the coal mine.
Yeah.
Like, marginalized communities need to stick together because we're all going to be we're all marginalized. Like by definition, we are the ones that are not compatible with the dominant white, society. So, okay, closing question, which I think is probably the most important question, because people are exhausted. People are literally exhausted. They're going to be doing Repro Shabbat programming all weekend. But like since last summer, really since the Supreme Court, draft was leaked last May, and just all of it is so exhausting. it's so easy to kind of throw up your hands and be like, we lost the fight, and you don't do that. I don't do that. You really don't do that. I try to remind people that, like, when it comes to the Jewish community and Zionism, it was 2000 years of fighting to return to Zion. And even, now Israel exists as a sovereign Jewish state. And 75 years later, we're still fighting for our lives every day. So even when you've achieved some measure of freedom, having achieved Roe in 1973 and 50 years later, having to basically start from scratch, we don't have the luxury of being exhausted. So how do you kind of get people back into the fight, back into the movements? Like, what do you tell people that really they should be doing or can be doing to actually change?
For me, it's about the things that we can do, right? It's about knowing the things that we can affect right now to expand or protect care for people that need it, right? It's making sure that we understand which states have access to care and making sure that we support, organizations, philanthropies, funding, not like innovation, right? So making sure that the telehealth companies are funded and out there so that they can, deliver medication abortion to people in rural parts of states where abortion access is protected. It's getting involved, it's donating to abortion funds, it's making sure that you are an ally for people that need it. There are people that, it's volunteering, but it's also, just not checking yourself and making sure that even if you're tired, like, now imagine if you were pregnant and you didn't want to be in Texas, right? Like, how tired do we get to be, right? Not if we are still free of the burden of being forced to stay pregnant. That, like, to me, that's the check, right?
Yeah.
Because that is where we are, right? There are women every day in America right now who are being forced to stay pregnant because they don't have access or opportunity or whatever it is. And they're not me, I'm not them. So I'm gonna still do what I can until that isn't the case. And again, before Dobbs, it was the case. There were still people who, didn't have access to care, even when we had Roe. And so Roe wasn't perfect. It was better than not having it, but there is a lot of work we can do to make the world in a post-Roe, post-Dobbs better than the one that even we inherited from 1973.
Wow, what a good way to end. I feel this much better. It is true that Roe didn't get us nearly as far as we needed to go, and that there were problems before Dobbs, but it certainly feels, I mean, when I say we're exhausted, like, I'm also talking about the unintentionally pregnant or pregnant people who are pregnant who don't want to be pregnant in Texas. They're exhausted,
Yeah.
I mean, they're like, instead, I think a lot of people, from stories that I've read, a lot of people are just like throwing up their hands, like, I can't take off work to go to New York to get an abortion to, and like, so they're having a child.
Which is, last time I checked, wasn't less exhausting.
Right. I'm confident that's true, but if you feel like you don't have any choices and there's nothing left to do, it sometimes feels easier in that moment to just be like, it is what it is. And so for those of us who are not struggling with that particular thing in this moment, to be able to remind ourselves of the privilege that we have and use it accordingly is, I think.
I mean, I feel like that's our whole life, right? Is looking at the privilege we have and using it accordingly.
It doesn't mean you're a billionaire. It means you have something.
No, it's a privilege is not about how much money you have, ever. It can sometimes be your access to information. It can be your network. It can be your voice. It can be your protections against, all kinds of persecutions. I mean, yeah, there's a lot there.
Yeah. Dara, thank you so much. I always learn so much from you. I'm sure other people have too. And Dara said that people who need doctors and care and how complicated it is. I'm just going to give everyone Dara's number because I call her. I might blow my nose. Dara, what's wrong with me?
Yes.
But you're amazing. And if only we all had an ounce of the energy that you have for this fight, seriously, we would all be better off. Thank you.
I would say that I'm tired this week, but I also think that that's why I'm going on vacation tomorrow. But I also think that like I said, the thing that inspires me is how many people are doing this work. It's a lot of people. And it's been for a long time. I think the other thing I will just remind everyone is people have been doing this work for a long time and have not been recognized. And so it's time to recognize the longevity of this movement and remember that there are new ways to get involved and to just raise your hand. And I'm sure there's somewhere you can go.
Thank you so much. You are absolutely amazing. And I'm so grateful for you and your leadership and your friendship.
Thank you.